statement of the problem, purpose of the study, down to the conclusion. The Roman poet Virgil said, "The greatest wealth is health. And without health, any other form of wealth becomes meaningless and less valuable." And I hope you believe that. So the 4 major non-communicable diseases are diabetes, cancer, stroke, heart disease, obesity, and arthritis. And the US Department of Health and Human Services said that health care burden is projected to increase by 15% by 2020. And Dr. Galvez says that tragedies such as plane crash, road accidents, shootings, hurricanes, typhoons, among others, that lead to mortality are often reported as breaking news to the public. But the pandemic diseases, known as the communicable diseases, are never reported. And they are the leading causes of deaths today. There have been a number of studies on the impact of non-communicable diseases. However, they fail to give the participants a chance to talk about their knowledge on NCDs and the impact in their societies, because it is quantitatively done in most cases. So this study will help to promote awareness of NCDs among the participants, the organization, and the health professionals. Another purpose of the study is to promote awareness among the Adventist pastors in the western part of Kenya, where the study will be done. And then it's to propose change of lifestyle to prevent NCDs, to propose innovative ways to implement health promotion programs to the pastors and the wider community. Another thing, it will contribute to the effective application and sustainability from the participants' perspective. Okay, the significance of the studies: it will help the church organization to promote awareness of NCDs among the pastors, to sustain the benefits gained out of the knowledge of NCDs. Findings will contribute to literature of the impact of the NCDs among the Adventist pastors, which is quite limited, and the recommendation for further studies. Before I go to my research questions, I talked about to propose the change of lifestyle to prevent NCDs. Somebody might be wondering, what is this change of lifestyle among the pastors? This is a proposal that I will do back home. And why am I doing this research? First of all, is out of observation of how our pastors live back home. In most cases, when what I've seen back home, the pastors are becoming bigger than usual. And that can be has been contributed by the sedentary life and also the foods that they are eating. So, especially where I come from, where I am talking about is a rural setup, where people have been eating more healthy foods. But what is the new trend now? For example, our pastors go for week of prayer, and as you know, back in Africa, during the week of prayer, it is like a big celebration, and our pastors are really treated very well. And what is the treatment? It is food. So you find that every evening the pastor is done with the program, they're invited to a home, and it is like a big feast. The feast continues for quite a long time, and it could be a reason why our pastors are getting bigger and getting these NCDs. Another reason is living the sedentary life. Now, most of the pastors can afford to drive cars around. So they literally have no time to walk, and things like exercise has not really been emphasized to our pastors back home in Africa, especially not just in the rural setup, even in the towns. It is not very emphasized. So pastors think that maybe it is for athletes or something. Like, for example, in Kenya, we have the athletes who are always running around doing their practices. So many people associate that with the athletes who want to go and win gold at the Olympics. I'll go back to my research questions. what I'm going to ask is, what do the participants know about NCDs? What are the common NCDs known by the participants and the causes? What changes would they like to make in their lifestyle to prevent, manage, or reverse the NCDs that they experience? How can the participants share their awareness of the impact of NCDs to their families and to church members? My theoretical framework, the study is founded on the theories of planned behavior and psychological theories to promote healthy lifestyle. This theory emphasizes that one's behavior is determined by what they want to achieve. Therefore, it is formed by the attitude, culture, and desired behavior intentions, and that which leads to behavior control. My literature review I did through the broad scan, focused review, and comprehensive critique about the non-communicable diseases. It is a major cause of the death, globally causing 70% of all the deaths. That's according to WHO 2018. The major risk factors stemmed from environmental and lifestyle factors such as use of tobacco, alcohol consumption, unhealthy diet, inadequate physical activity, and lack of positive psychology or psychosocial stress. Obesity and diabetes type 2 are related to the most of the NCDs. Most of the patients of non-communicable diseases are associated with overweight, sedentary life, eating little or no breakfast, eating too fast, lack of quality sleep or insomnia, working under pressure, being irritant, muscular strain and anxiety or depression. I'm very sure that some of you could be relating to this because many people cannot practice all these things together. You find that maybe you've controlled your weight, but you don't have quality sleep. Sometimes, many times you work under pressure, and especially students and sometimes pastors, they have so much to do. They're needed in every situation where there's sadness, where there's happiness. So you can imagine the change that comes in their hearts and minds. Intervention to curb non-communicable diseases have been done in the countries such as the United States and other developed countries. And their objectives mainly is to prevent, arrest, and reverse lifestyle health conditions. These countries have initiated the prevention of non-communicable diseases through their companies. It is a policy in a company that they should have something for the workers, and they also have the insurance. At the same time, there are programs, the health promotion programs that have worked in these countries, and they have seen changes. And this is because of the availability of resources and knowledge that has been made aware. The programs, the ones that have been used, promote eating whole foods, consumption of whole grains, legumes, fresh fruit and vegetables, and liberal amounts of water, and then less use of cholesterol foods, fats, sugars, and salt is discouraged, and encouraging physical activity. World Health Organization estimates that from these NCDs, there will be increase by 17% globally, and Africa will have a little more portion of 27% in 10 years. This exceeds death from communicable diseases such as AIDS, HIV and AIDS, malaria, then maternal, perinatal, and malnutrition combined. The WHO says that the countries that are affected most are Mauritius, Namibia, and Seychelles in Africa, because they report 50% of all of the deaths caused by NCDs. It is similar in other parts of Africa. It's just that the percentage is a little lower. Controlling NCDs in Africa has been a challenge due to lack of resources, policies, and strategies for controlling. Studies have been done, and we have the study of Adventist Health Study 2 by Fraser on longevity among church members, what has been referred to as blue zones. This has only been done in the developed countries, and none of this has been done in Africa. Other studies have been done by the programs like CHIP, Complete Health Improvement Programs, in different parts of the world, but they have not really come to Africa. There are limited studies on Adventists in Africa in general, and on Adventists, and particularly to Adventist pastors. We have learned that NCDs are not only the 4 major ones. There are several number of NCDs, and these are some of the NCDs that are found in Kenya. Apart from the diabetes, we also have the endocrine disorders, which people don't talk about. Yesterday we heard about the dental. There's skin disease. We have digestive diseases, which people don't really talk about because they don't know that it's part of NCDs. Okay, as I do my study, the methodology I'm going to use is the qualitative case study, focusing on discovery of insight and understanding from the perspective of those being studied, and offers underlying the meaning of the context. The sampling technique will be purposive. It will be done on the church pastors from the Union Mission who will be willing to share. I will do the focus group interviews and in-depth interviews using the semi-structured questions. Primarily, I will be the instrument as the researcher. Other sources will be individual interviews, the focus group, and observation. Integrity will be maintained using triangulation matrix, meaning that I will get information from different sources. After that, I'll do a transcription collected by verbatim, documentation of all the recorded sessions, and then I'll transcribe the subjects and then do a members check. That is sending back the work again to the people who participated, asking them if they could make any changes, if they're comfortable with the information they shared. Analysis will be done by reading through transcribed data and classifying them into categories. The categories will be coded and labeled based on emerging themes. My conclusion is that this qualitative case study is designed to bring out meaning from experience of participants. It will empower the participants to share their stories of their awareness of NCDs. Through the findings, there will be proposal for the church organization in that region to do more awareness on prevention, maintenance, and reversal of NCDs that affects the pastors around there. Thank you so much.
Thank you so much, Sister Ruth. Any questions, suggestions? This is a proposed study that potentially will benefit pastors, and beyond that, of course, the rest of the church. And upon seeing Elder Guizo, the church said, Amen. Amen. We missed you so much, Elder. It's good to see you. Welcome. This is AATA Forum. Thank you. Okay, so questions for this proposed study so that it will really be a solid and strong contribution. As it could be questions, it could be input on how to improve the study. Maybe I could start with a question. Thank you so much for the, proposal for this study. Yes. I think it's a very important thing. Did I hear anything about maybe getting the, whatever it is, the measurements and so on, like weight, body mass index and things like that and so on? Is this part of what you propose? Or it's more like getting to know how we as African pastors are living our lives or something like that?
Okay, it will not include all that, the BMI, taking the BMI and all that. First, we want to know it is the awareness. Do they know that this is the cause of NCDs? Because, as I said, that it is now the cause of many deaths among our pastors back home.
So, thank you for your presentation. Good. Very nice, very pertinent. very significant for the church. Now, in your research, what was for you the most surprising thing that you're not expecting to find? You know, as you are reading, researching, and interviewing people, what was surprising for you that you're not expecting, let's say?
Okay, I've not done my interview because it is a proposal. But I should say that it is quite a shock to know that NCDs is becoming common in Africa, even, I mean, compared to developed world, and nothing really has been done about it. I mean, and whatever which is being done is a bit slow. It has no impact yet. Excuse me. And I'm just imagining that if NCDs are escalating, at the same time the communicable diseases are there. So what will happen? That has been my, should I call it my burden or a surprising thing?
When you were describing the condition of pastors in Kenya or that part of Kenya, I thought you were describing the pastors in my region. Fiji, Tonga, and Samoa are not pastors, people, and including pastors, unfortunately, Adventist pastors as well. It's if you are slim, that means you are a poor man. So it's a status thing to be big. It means you are strong enough to have your garden, and your people are looking after you, your members are looking. So the members, they have that mentality, we have to look after our pastor, and so they bring the food to the pastor. And it helps the pastor to grow not only in spirit and in truth, but also sideways and forward. So I just want to appreciate your presentation. It's a challenge to us. It's something that we, when I was in administration, we challenged our pastors with. It was a challenge for us. We instituted health checks, annual health checks, and then we started to require anyone that we employed or recruited from college or from anywhere to be a pastor, they had to be medically certified fit. That helped a bit, but it began to reach a stage that where if we were strict on it, half of the pastors we would have to lay off or not recruit. So we had to work on the workforce that we had to make them fit before being strict on those that we recruited. So I'm looking forward to the rest of your study. Thank you for that.
Thank you so much. That has been really the, excuse me, the trend. I mean, what is perceived as also back in Africa. If you're small, there's a problem. If you're big, you're definitely rich. So it's the same thing. Thank you.
Yes, thank you, Ruth, for your presentation. Though this is a qualitative study, but I think that the suggestion from Pastor Mbureri is quite critical and important, because including some baseline information about the health status of the pastors will be quite helpful. You know, some anthropometric measures, you know, as part of the study, that would be quite helpful. Thank you.
Thank you so much, Prof. Yeah, that is part of my recommendation that further studies should be done. It can be quantitative or qualitative. Thank you so much.
Thank you, Ruth, for your presentation, your proposal. I'm delighted that you're proposing to do something practical. I know from experience that sometimes as Adventists we are very good at having the knowledge, but very poor at implementing what we know. And I'm wondering, does your study include anything in terms of the doing aspect? You know, not just knowledge and attitude, but actually, you know, doing something about that knowledge.
Thank you so much. Yes, my study has something to do with the implementation of a program that can help to curb the NCDs among Adventist pastors. And I believe that when something is done to the pastors, when knowledge is given to the pastors, it reaches other people so easily, and it goes to a wider community, because people, I mean, a pastor has control of crowds, and apart from just, I mean, preaching the sermon, they can do health education to the people.
Thank you, Sister Ruth, for your good presentation. And since you are interested in the well-being of pastors, I'm also very happy because I know how pastors face different challenges, and sometimes no one cares. And my question is, what would you propose or suggest to the leadership of the church, I mean the administrators, in a way of handling and help those pastors who always work under pressure, and also they lack quality of sleep, because I think this is what is killing them prematurely. And we need them to live because they are serving God, but always there is a hammer which is always on their head, and sometimes it doesn't really help them to live longer and also maybe serve better. What would you suggest? Because I'm saying this because a study like this has always been there telling the good thing, but we don't say anything. So what would you suggest in a practical way?
Okay, first of all, as Adventists, we have the health message. We have to agree that we have it. But the problem is implementation. And okay, for me, I'm a church member. And I believe that my pastors know more about the health message, and I should be getting it from them. And another thing that I've been wondering, I'm glad, Professor, you're here from the seminary. As part of the curriculum in the seminary, is there anything to do with health message? Because in my experience as a church member, I've not really had a pastor bring it out, even the way it is in the books from the Spirit of Prophecy. That is one. Secondly, even as I was growing up, we had a program known as Health and Temperance in every camp meeting every year. But in my experience, it was not really teaching us the consequences of bad habits, as in diseases that can come to us. It was mainly, don't drink tea, don't drink coffee, don't eat meat. Reason? There was no really good reason. There was nothing about the disease. It was all about, you will not go to heaven if you eat these things. It is sin. But what I think is that awareness through education should be done. An emphasis should be done to our leaders, to our pastors, and it will automatically go down to the other people. And if our pastors are healthy, then it means everybody will want to do what they're doing. So, Pastor Leonidas, I think the best thing is education, as Mrs. White says, educate, educate, educate.
Well, thank you so much. And I would seriously recommend also to you, for you to consider your recommendations seriously and try and implement some of those recommendations. Meaning, may it not be a hit and run kind of study. Mm-hmm. I think there's need to really do a series of studies and so on. In other words, for you to be our Gary Fraser in Africa. So, ladies and gentlemen, we may put our hands together in appreciation. Thank you so much, Sister Ruth. May God bless you. You have thumbs up from the house.
Thank you
Go
very
ahead with
much.
the study. We are now getting to our next presentation.